And I would think, I mean, are there other measurements you can do? Are you also, maybe while people are having the psilocybin administered, are you, having their pulse checked and I don't know, any kind of frequency, brain frequency action, or are any of those things being done?
Yeah, I would say that a lot of these measures, as compared to the probing verbally of what are you experiencing right now, which is potentially quite intrusive and sort of contrary to the ideally what's actually occurring psychologically, that could be very interruptive. A lot of these measures can be acquired passively, unobtrusively. We could be certainly measuring basic indicators of CNS function, like through EEG or blood oxygenation in an FNIR system, something like this. While the person is laying there, it's essentially being acquired and potentially analyzed actually in real time. Rob, we've discussed in a recent meeting having basically a TV behind the bed, and we literally can observe some of these sort of macro indicators, like you were saying, Rob, second by second, actually, so we can see changes occurring. But I think, and as you say, Deborah, as well, a number of other indicators may indeed be relevant, things like blood pressure, heart rate, and its variability. Those all are sort of very general indicators of essentially the arousal of the person. Are they, in fact, obviously highly aroused, perhaps distressed, or perhaps that high level of arousal is, in fact, sort of a positive indication that they're experiencing some excitement that is, in fact, something that they see as helpful. So it's hard always to know, and we may need to query and check in, but some of those measures can easily be acquired during the experience. But this, I would really emphasize these kinds of measures. What we're trying to understand here is the mechanism of the ultimate therapeutic effect. But ultimately, what we really want to see is the long-term benefit. So we don't want to just understand, the physiology and the psychology of the experience while under the obvious immediate effects of the substance, but rather the long-term outcomes. And so I think beyond just having them be in an MRI machine, for example, while they're intoxicated, instead, let's also consider to do the MRI a couple weeks or a month after the experience. And if we can see a normalization at that moment, that's even more convincing, because ultimately that's what we really want for our patients to recover from their mental problems, depression, PTSD, for them to recover. And so if we can see some of those biological markers of the recovery, the long-term recovery, that's going to be especially encouraging.